Hi there, my name is Lindsay Pratt, and I am a PA at the University of Colorado in the Department of Hepatology and Liver Transplant. I've been a PA for 15 years, practiced in private practice gastroenterology for 2 years, and for the past 13 years, I've been in hepatology and liver transplant. And I'm happy to chat with you today about MASLD and MASH. So common questions that I get from primary care providers about this patient population. So one of the questions I get is, who should I be screening for MASLD and MASH? Should I be screening everyone? And generally the guidelines state that you want to be screening patients that certainly if they have elevated liver enzymes, if they have evidence of hepatic steatosis on imaging, if they have multiple cardiometabolic risk factors, so think about your metabolic syndrome. So most important risk factor is going to be prediabetes or diabetes, but also hypertension, hyperlipidemia, obstructive sleep apnea, sort of that whole phenomenon of metabolic syndrome. We know that MASLD and MASH is sort of the liver's way of expressing metabolic syndrome. So those are the patients that you really want to screen. And then kind of how do we start the screening process? So that FIB4 test is just so handy because all you need is the patient's age and their platelet count and their ALT and AST. So you just need a CBC and a CMP to calculate this. And if your FIB4 is under 1.3, then you have effectively ruled out advanced fibrosis. I mean, you can recalculate that, every 1 to 3 years, kind of depending on the patient's risk factors. And then if it's in that indeterminate range of 1.3 to 2.67, or certainly greater than 2.67, then that patient needs a secondary test. And most often we're going to FibroScan if that's available. And then you can kind of stage further based on the FibroScan results. I would say another very common question that I get multiple times a week from primary care providers is it okay for me to put this patient with liver disease on a statin? Or is it okay for me to continue their statin? Yes, please put them on a statin. Please continue their statin. There's no need to stop it. The risk of true drug-induced liver injury with statins is actually very rare. It's just not something that we see clinically. And furthermore, we know that statins can actually be very beneficial for the liver, and treating their hyperlipidemia is actually part of treatment of MASLD and MASH, is really optimizing control of their other metabolic disease. So absolutely okay to put these patients on a statin and to continue their statin. Please do. And that is all I have for today. Happy to field any questions. Please do reach out to me on my MASLD Community Network site.